So we're really happy to welcome back Alyssa Sutton from the International Foundation for Gastrointestinal Disorders, who's going to be talking to us today about GERD.
So today we are going to be talking about gastroesophageal reflux disease, otherwise known as GERD. My name is Alyssa Sutton. I am currently the program coordinator at the International Foundation for Gastrointestinal Disorders. People usually just refer to us by our shortened name, IFFGD. I've been working there now for almost 4 years. It'll be 4 years in December. I started with them just kind of to help launch our new websites. We currently have 9 websites. 7 of them we were relaunching in 2021. And after we finished that project, they asked me if I wanted to come on full time. So I've been working with them as the program coordinator ever since. Typically, I work on the patient side. I work with a lot of the patient engagement. I get to talk to the patients about the impacts of the disorders. And it's really been eye-opening to kind of introduce myself into the GI space and understand the way that these GI disorders do impact the lives of these individuals on a day-to-day basis. If you've never heard of our organization, I'll give you kind of like my brief recap of it. So we started as a nonprofit organization back in 1991. It started with one woman named Nancy Norton. She herself struggled with the functional GI disorder of incontinence after giving birth to her child. And she wanted to learn more about ways to manage and treat her condition. And so, really, she started this organization from the ground up. And from there, we were able to expand into incorporating all functional GI disorders. And then we grew to incorporating some motility disorders and also some rare diseases. So, I think currently our organization talks about 40 different disease states, and we continue to grow as we learn more about different disorders that people are going through. You may have heard our organization be referred to as different names, but we've always had the same mission, which is to inform, assist, and support those that are living with GI disorders. Within the last 3 decades, since we've been around for 30 years now, we've really created a network of different families, patients, regulators, employers, and researchers, and healthcare providers, and just other stakeholders that are able to help raise awareness for GI disorders and also promote that research and enhance the digestive health of adults and children. And not only do we advocate for digestive health, but we do offer complimentary resources. You can go to our website at www.iffgd.org, and we have a publication library. All of our resources have been written by different experts in the field. And really, we try to tailor these resources to really meet the needs of our community and to try to write them at a lower level because we know children are trying to access this information as well. We want them to be able to comprehend what they're reading. So all of our resources, we try to write that focus towards the patient and not for physicians. So gastroesophageal reflux disease, I know that's a long phrase, but it's one of the most common GI disorders. And it's really just a condition where the stomach contents are going to flow back or reflux into the esophagus. And this really can cause some troublesome symptoms for a lot of the patients, and it can even cause some damage to the esophagus. Now, GERD, like I said, is very common. It affects anywhere from 1 to 5 people, adults, men and women included, but it can also affect children. There was a recent population study, I think it was conducted back in either 2021 or right before then in 2020. And what they noted was that Americans reported having GERD symptoms in the past. It was 2 in 5 Americans said that they had GERD symptoms in the past, and 1 in 3 of those patients had said that they've experienced GERD symptoms within the past week of taking this survey. Fortunately, though, GERD is typically a very treatable disorder, but seeking proper treatment is essential in avoiding any more serious complications. So there are 2 different types of GERD that you could be diagnosed with. So due to the lining of our esophagus being repeatedly exposed to acid content, tissue damage, like I said, can occur. If you have symptoms and tissue damage is present, they are going to refer to that as erosive GERD or esophagitis. If you have symptoms, but there's no tissue damage present, they're most likely going to refer to that as non-erosive GERD. GERD can often persist with symptoms like heartburn or acid regurgitation, but sometimes patients don't experience any symptoms at all. Now, as I mentioned, the 2 most common is the heartburn and is the acid regurgitation. Acid regurgitation just really means that that acid is flowing all the way up. You can kind of taste it in your mouth. But other symptoms of GERD can include difficulty or pain when you're swallowing. It can include excessive belching. Something something called dysphagia, which is really just the feeling of something being stuck in your esophagus, chronic sore throat, or an irritated larynx. The larynx is really just the voice box and right where your vocal cords are. Inflammation to your gums, the erosion of tooth enamel, hoarseness in your voice, and it can also have a sour taste in your mouth. And just like I said, it's so important to seek professional help if you're experiencing any of these symptoms, or if any of these symptoms are persisting for long term, because GERD itself can lead to more serious complications. So just kind of focusing in on heartburn, I know this is something that everybody experiences. Heartburn is very common. Most people describe heartburn as a burning sensation in their chest that can radiate upwards towards their throat, but it's usually caused by that acid reflux just sitting there in your esophagus. Our lining of our esophagus is a lot more sensitive than our stomach. And so when it's sitting there, that burning sensation is going to be felt. People also describe just having chest pain. So even though it's not a burning sensation, you can just experience pain in your chest. In people with GERD, though, persistent heartburn can be painful. It can start disrupting your daily lives, and it can even wake you up from in the middle of sleeping. Now, like I said, heartburn is really common. It's actually estimated that about 20% of Americans experience heartburn at least once a month. However, when that heartburn becomes chronic, or if it persists, then that's when the acid has that potential to start damaging the esophagus. Now, if that does happen, this can cause things like an ulceration, which is an open sore in your esophagus. It can cause a stricture, which is the narrowing of your esophagus, or it can also cause you to have difficulty swallowing. So after we do swallow food, the food travels down and it gets into the stomach, and that's where our stomach starts producing acid and pepsin. Both of those combined are going to aid in the process of digestion. We have something that is located right between our esophagus and our stomach, and it is known as the lower esophageal sphincter, or LES. I have a picture here. Really, that's just a band of muscle that is separating the two. What happens when that food travels down is our LES will open, it'll allow the food to enter the stomach, and usually that LES will close again. Now, if the LES is opening at an inappropriate time and or is otherwise compromised from something like a respiratory illness or surgery, it can open back up, and that's when that reflux flows back up into our throat of the esophagus. There are some diagnostic tests that they can do to determine whether you have GERD. However, a lot of healthcare providers will just diagnose you based on the presence of symptoms alone. But the first diagnostic test is something called an endoscopy. So this is where they put a thin tube down your esophagus to examine the actual esophagus, the stomach, and they'll even examine part of your upper small intestine. What this will do is usually they'll put the patient to sleep or they'll sedate the patient. That way it's a more comfortable procedure. But the tube has a camera with a light at the end that allows that healthcare provider to see what's going on inside. And there they can determine if any damage is present, and they can also examine that LES to see what's going on there and if that's the main problem. While the patient is sedated, it's possible that they can take biopsies from your esophagus to make sure that Barrett's esophagus, which I'll talk about in the next slide, to make sure that that's not present. The next diagnostic test is called the esophageal manometry. This is another thin tube, but this one is inserted through your nose, and they examine the esophagus and again the LES to make sure that both of those things are functioning properly. It's pretty much the same as an endoscopy, but you're not going to be sedated. It's not going down your throat. It's just going through your nose. And the final diagnostic test that they could do is something called an esophageal pH monitoring. So this is where they measure the amount of acid in the esophagus over a 24 to 48 hour period. So what they can do is they can either put the tube down and examine what's going on, or they can attach a pH sensor to your esophagus so that you can perform daily activities within that 24 to 48 hour period. And what this is going to do is it's really going to measure and tell them how much of that reflux is causing the symptoms, how often that reflux is going to occur, and how much acid is actually being refluxed. Now, like I said, sometimes due to insurance coverage and things like that, those healthcare providers aren't going to perform these diagnostic tests. And what they'll do is they'll go off your symptoms alone. They'll prescribe you a medication. If your symptoms get better within 2 weeks, they'll typically diagnose you with GERD. However, I do want to stress that it's so important to advocate for yourself. Basically, just providing you with a PPI and handing you a medication is just like slapping a Band-Aid on your symptoms. You're not going to be able to know if any of that tissue damage is present, how far this has gone on, if there's any more serious complications. And so really, I would just, stress to advocate for yourself. If you think it's something more serious, if you think you've had it for a while and you want to know if you do have any more serious complications, make sure you talk to your healthcare provider about that. And you can try to get that coverage from your insurance to make sure that you can get those diagnostic tests. So I've mentioned Barrett's esophagus already. What this is it's basically a precancerous condition. It's a cellular change that's happening in the lining of your esophagus. Now, this was actually a medical term that was coined by a pathologist named Norman Barrett, and he first identified an abnormality in the lower esophageal lining. It was originally believed by Dr. Barrett that this was due to a congenital issue where the person was born with a short esophagus. However, it's now understood and believed that it's not from something congenital. It's actually just due to that long, persistent, severe GERD that you are experiencing that's causing that cellular change to occur. And now it's important to mention too that while most people with GERD don't have any abnormality at all, those who do are at a greater risk of going on to develop esophageal cancer. Only a small number of patients with GERD, about 5 to 8% of patients, are actually going to go on to develop Barrett's esophagus itself. So I know this sounds scary because it can lead to a precancerous condition, which then can lead to a cancerous condition. But the statistic says that only about 1% of patients that are diagnosed with GERD will actually go on to develop cancer itself. People who are most at risk for developing Barrett's esophagus are patients that are over the age of 50, patients that have experienced heartburn that is persistent for over 5 to 10 years, and also in Caucasian males. If the patient is diagnosed with Barrett's esophagus, you'll usually just go in for regular endoscopic screenings every 2 to 3 years to make sure it's either staying the same, getting better, and not getting any worse. Again, please keep in mind that not everyone that experiences frequent heartburn will go on to actually develop Barrett's esophagus. For some reason, and it's still unknown, some people can have heartburn and have absolutely no esophageal damage present, while people that have never experienced heartburn can actually have damage to the esophagus. So that's why we really do stress it's so important to see the healthcare provider for an evaluation, because this provides that opportunity for you to get that endoscopy and make sure that the presence of Barrett or any other related conditions are not present. So diet and GERD. Diet does not actually cause GERD itself. I want to make that known. However, if you do make changes to your diet, it can be more effective in helping manage your symptoms. So certain foods are going to aggravate the symptoms of your GERD, and this is going to include things like chocolate, your fried and your fatty foods, peppermint, alcohol, caffeinated drinks, and any type of acidic foods. I like to say it's all of the best stuff that I frequently enjoy, so that stinks for me if I ever develop GERD. But diets high in fat are also a higher risk factor for later developing Barrett's esophagus. If you frequently eat spicy foods or very citrusy foods, that can also worsen your heartburn later on. If you have large fatty meals, that can actually slow down the emptying of your stomach, which can kind of make that LES open at those inappropriate times, which can lead to that reflux flowing back. If you do have a diet that is high in fruits and vegetables, of course, vegetables and fruits that are not very acidic, that can actually help protect your esophagus from getting damaged. And it has been known that Mediterranean diets, if you're somebody that enjoys that type of food, that type of diet has actually been linked to having a decreased risk in developing GERD. If you are somebody that makes dietary changes, make sure you consult with your provider or a dietitian that is knowledgeable in this, because sometimes when we change our diet, we don't get all of the essential nutrients and vitamins that our body needs. So we always stress to find somebody that's knowledgeable to make sure that your body is getting the nutrients that you need. Now, about 25% of patients have said said that stress itself makes their heartburn worse. There was a study that was conducted where they used that pH monitoring that I talked about earlier. They attached it to the esophagus, and it was able to indicate to us that stress itself is not actually going to produce or reduce the amount of acid that your body is creating. Now, that being said, though, the perception of your symptoms when you are going through a stressful event can be heightened because it's known that when you experience stress, your nerves can feel things a little bit more, they're more sensitive, and so you may experience heartburn and your acid regurgitation at a much heightened level if you were not experiencing stress. That being said, it has been suggested that just simple techniques can help in alleviating some symptoms such as stress management, like relaxation exercises, mindful meditation, or even cognitive behavioral therapy. These have all been found effective in helping not only reduce your stress, but also reducing that severity of your symptoms and the perception of that severity. There are very simple lifestyle changes that you can do to greatly improve your symptoms as well. There are some tips that we've had patients reach out to us about, and also healthcare providers. That includes avoiding laying down anywhere within 3 to 4 hours after eating, raising your bed up to 6 inches at night, just the head of your bed, so that way, gravity can help and that acid doesn't sit in your throat all night. Sometimes avoiding eating or drinking coffee up to 1 hour after waking up can also be beneficial, and also making sure that you include physical activity throughout your day and making that consistent. It's also important that you avoid things that aggravate those symptoms, such as alcohol, carbonated beverages, or even the use of smoking with tobacco. So there are different medications that can be prescribed. If diet doesn't help, if those lifestyle changes aren't helping alone, then you can be prescribed one of the 3 medications that I'm going to talk about. The first one is a pro-motility agent, and really what this does is it helps speed up that emptying of the stomach, which I mentioned before. If your stomach isn't emptying at the normal rate and for some reason is slowed down by the types of food that you're eating, it allows that reflux more time to enter the esophagus. So there is a medication called metoclopramide, but basically this has been known to be prescribed to patients that either have a mild erosive GERD or non-erosive GERD. However, the use of this drug, we do want to stress, should be carefully screened with known risk factors. The FDA recently, I think it was in the past couple years, released a warning that they want to discourage the long-term use of metoclopramide because that can cause adverse effects. The next type of medication is known as an H2 blocker. What these are going to do is it's going to reduce the amount of acid that's actually being produced in the stomach in prescription doses. Now, these are going to help eliminate your symptoms, which is going to allow that esophagus to heal if it's damaged. And usually the healing of the esophagus occurs in about 50% of patients. That being said, remission is typically only maintained in about 25% of patients using the H2 blockers. You can note at the bottom of the screen the type of H2 blockers that can be prescribed, but these are the 4 different types that you may have heard of in the past. One of the most common types of prescription medications is called a proton pump inhibitor, or a PPI. I mentioned this earlier on, that this is typically a first-line defense for patients that are diagnosed with GERD. This is also going to work like an H2 blocker. It's going to reduce the amount of acid that your stomach is producing, and it's going to allow that rapid relief and healing of your esophagus. This typically occurs in about 80 to 90% of patients, which is why this is typically the first-line defense for patients with GERD. Now, this can also help with things like a stricture, which is one of the more serious complications of GERD. This medication is typically the one you'll most likely hear of when you're diagnosed with GERD. Patients also can take antacids. These are usually over the counter. These are just designed to neutralize the acid that you're experiencing to make your heartburn less painful. So this is typically what patients are going to try first without going to that healthcare provider. But keep in mind, this may help the symptom of heartburn, but this isn't actually going to get rid of the reflux itself. And the last type of reflux I want to talk about is something called LPR. The long name for this is laryngeal pharyngeal reflux. This is actually something that I personally struggle with. I was diagnosed with it back in 2021 after my first COVID infection. And this is reflux that travels all the way up the esophagus, and it's going to sit right here on your larynx or your voice box. So you're going to experience some of the common symptoms of GERD. You're not going to experience heartburn most likely, but you will have the feeling of wanting to clear your throat very frequently, having hoarseness within your voice, coughing, and or the sensation of something being stuck in your throat. The typical cause of LPR is an upper respiratory illness, and then the symptoms may stop once that illness has subsided, but sometimes those symptoms can linger even after your body was able to fight off the illness or infection. Treatment for this is typical. It's taking that PPI twice a day for anywhere from 2 to 6 months. They also recommend that you intake plenty of fluids to prevent any dry throat from occurring, and also avoiding tobacco, caffeine, alcohol, antihistamines, and also cough drops that contain menthol, as these can actually have a drying effect on your throat. Now, since throat clearing is one of the most common symptoms that you're going to experience with this, there are things that you can do to try to eliminate the amount of throat clearing that you're doing, because this tends to actually worsen the injury and make your vocal cords a little bit more inflamed. So what they do recommend is to try swallowing in order to clear your throat, or exhaling very forcefully rather than coughing. You can also tap on your vocal cords, or you can tap them kind of together with like a little thing instead of doing a very forceful throat clearing, and that can help. Now, this is actually more treatable. It's typically easier to get rid of than GERD. If you're somebody that has LPR, I do recommend going in. I was diagnosed by an ear, nose, and throat doctor. You can be diagnosed by them or a GI doctor, but it's good to make sure that you get that necessary treatment in order to stop that from occurring. So really, I want to talk a little bit about some of the patient quotes that I have pulled from our website. We have the opportunity for patients to submit a personal story. They can do this through our www.aboutgerd.org website, or you can submit a personal story through our main IFFGD website, which is www.iffgd.org. But I just wanted to start with some quotes because it's always so important to understand the struggle of an individual that's actually experiencing GERD, as this can really help open the eyes of individuals who've never experienced this themselves. So the first quote is, "I kept waking up at 2 a.m. with my heart racing and sky-high blood pressure. I felt nauseous and chest and arm pain. I thought I was having a heart attack." Another patient said, "I used to really enjoy cooking and eating, and now I dread mealtime as food tastes different and I'm anxious about eating." And finally, it was, "I just want to eat a normal meal without having chest pain or feeling sick." And the reason why I pulled these 3 quotes specifically is because I think this is so common. Number one, I know from a personal experience myself, my sister was diagnosed with GERD about 2 years ago. And this happened after a lot of panic attacks, or thinking what was panic attacks, because she was experiencing chest pain. And they kept saying, "It's just your anxiety." After about 5 years of going through this, they finally were able to diagnose her with GERD, because she kept going in and advocating for herself to say, "Hey, this doesn't seem like I'm just having an anxiety attack. I'm not stressed about anything." So this is more common than you think to have that chest pain occur, specifically due to GERD. It's something that a lot of people do experience, which is one of the things that, is really so important of why we want to promote raising awareness, because GERD is so much more common than you think. Something like heartburn is going to occur in about 20% of people at least once a month. Don't always, rush out to, "Oh, I must have GERD if I'm experiencing heartburn once a month." That's not always the case. Sometimes just the foods that we eat can aggravate something and cause the heartburn to occur. But GERD can affect an estimated 18 to 28%. I know I mentioned earlier that they say it's typically between 1 in 5 people. That recent population study was about 2 in 5. But really, this is one of the most prevalent GI disorders that you're going to experience in the United States alone. So talking about GERD Awareness Week, so this is something that I know we usually typically designate a full month for GI disorders. Back in 1999, IFFGD first designated GERD Awareness Week. This happens each November. It sometimes sometimes will fall either the week before Thanksgiving or the week of Thanksgiving. But during this time, we typically raise that awareness for GERD and the impacts that this has on the quality of life for many individuals. So that's really the when this all started. Now, the how is really when we create our awareness campaigns. One of the employees at IFFGD, Haley McCorkle, she was actually here during the IBS awareness presentation that we did last April. She is the one that creates all of IFFGD's awareness campaigns. And really what she does is she brings in those patient voices. We find that it's so important to not only come with our own knowledge and understanding of what GERD is, but also it's so important to talk about that patient perspective of those that are actually suffering with GERD day to day. So what she does is she reaches out to the community and she asks them to tell her a little bit about what they wish the community would understand about this disorder, things that they would like to see in our current campaign, and talk about any new or upcoming struggles that they are currently dealing with. And this is actually something that we open up to our entire patient population. It's not just a small group of people. We do have something called a patient panel, which anybody is welcome to join. Within this patient panel, the patients will tell us kind of what their disorder is, how they're interested in getting more involved with our organization, and if they'd like to participate in things like this. So this is something that anybody can participate in. This year, our focus is really the impact of GERD, that GERD has on patients. And so this includes the quality of life and the way that that can be affected. It includes the lifestyle that patients have to adjust to in order to manage their GERD symptoms, and also the treatment options that are available. Now, this year, we are also really trying to stress the importance of seeking that professional help if your symptoms are remaining the same and still persisting, or if your symptoms are worsening in any way. We do have the hashtags you can see on the top of the screen that we are going to use during the week of November that the GERD Awareness Week is happening, and that is hashtag GERD is real, hashtag GERD Awareness Week, and hashtag Living with GERD 23. So really raising awareness about GERD is really why I wanted to talk to you guys about this, because what this can do is it can translate into a larger federal investment with research activities. It can also create a stronger commitment from the industry that's going to create those newer treatment options. If you are somebody that is interested in getting involved with IFFGD and help us raise awareness, one of the first steps is to educate. Educate those people around you about our complementary resources. Educate them about the struggles of patients with GERD. You may not experience GERD yourself, but you may know somebody that does experience GERD. It's so important to give your perspective as well, because raising that public awareness is so crucial to make people's eyes open and see what that struggle is. Another way to get involved is to join us on social media. We are on Facebook, we're on Twitter, and we are also on Instagram. So what we do during this week is we typically share campaign images as well as different information and patient stories about how these symptoms have impacted their day-to-day life. Now, we do typically have something called a GERD Awareness Week Toolkit. You'll be able to find that on our www.aboutgerd.org website. The only thing that we do ask is that you are somebody that shares on social media, that you use these hashtags to share it that are at the top of the screen, the hashtag GERD is real, hashtag living with GERD 23, or hashtag GERD Awareness Week. So that way we can understand how many people are not only trying to advocate for this, but also how many people are still currently struggling. And lastly, if you're a patient with GERD, or like I said, if you're somebody that knows somebody with GERD, we know that oftentimes the person that's living with somebody with this disorder can also experience struggles themselves. We really encourage you to share your story. Share it to help people understand how this disease affects you, how it impacts your lives. And you can do this by sharing on our website. You can do this by sharing on social media, share your story by word of mouth. But when we share and when we educate, you can talk to somebody who may have never heard of GERD before, and that's just educating one extra person who may not known about this disorder. And so it's so important that you share that so that we can make sure that other people are understanding this impact. You can also share the story with your congressional representatives. And what this is going to do is, our congressional representatives are the people that are going to decide how much money is going towards towards each condition, how much money is going to go towards the NIH, how much money is going to go to the FDA. And so your stories can have an impact of how those bills are going to be passed and how much money is going to be allotted. I know the patients in our community would be so happy to hear that we have other people that are sharing this awareness and bringing, more advocacy to your community, and to know that they have your support. So if you're somebody that wants to join us, please feel free. We'd love to have you join us to get involved. And so I'll just kind of leave us here with the information about getting in touch with us. If you want to get involved with our GERD awareness campaign in the future, I know that we already have things rolling out for 2023, but you can always reach out to us through email. You can email us at iffgd@iffgd.org, and we'll be able to lead you not only to some resources to provide you with some key points and help you raise awareness, but we can also help you find resources that you can use to share with your community. You can find a lot of these resources at our www.aboutgerd.org website. And this will help you really be able to share that information and educate that public and bring that awareness. Now, remember that we can always in any way support each other. And if you are somebody that is experiencing GERD, or you do know somebody that is experiencing GERD, you're not alone in this. And we want to be able to help you advocate.